RSV stands for respiratory syncytial virus. It's a name that might sound a bit intimidating, but it's something most of us have encountered without even realizing it. It's a common virus that infects most people by the time they are 2 years old. In fact, nearly every child will have had RSV at least once by their second birthday. You might be thinking, a virus? That sounds scary. And while it's true that RSV can be concerning, it's important to understand the full picture. But don't worry too much. For most healthy adults and children, RSV is like a common cold. Symptoms can include a runny nose, coughing, sneezing, and sometimes a fever. However, for some people, especially young babies, older adults, or anyone with weakened immune systems, RSV can be more serious. It can lead to bronchiolitis or pneumonia, which may require medical attention. RSV spreads easily through the air when someone coughs or sneezes. The virus can linger in the air and on surfaces, making it highly contagious. You can also get it by touching surfaces that have the virus on them. This includes doorknobs, toys, and even countertops. That's why it's important to wash your hands often, especially during RSV season, which typically runs from fall to spring. Good hygiene practices can help protect you and your loved ones from this common virus. While most people recover from RSV without any problems, it can be tough on babies. Infants, especially those under 6 months old, are particularly vulnerable. Their immune systems are not fully developed, making it harder for them to fight off infections. Their tiny airways are more likely to get inflamed and clogged with mucus, making it hard for them to breathe. This can cause significant distress and requires immediate medical attention. This can lead to more serious conditions like bronchiolitis, which is inflammation of the small airways in the lungs, or pneumonia, an infection of the lungs. Both conditions can be life-threatening if not treated promptly. Older adults and people with chronic heart or lung conditions or weakened immune systems are also at higher risk of developing severe RSV infection. Their bodies are less capable of handling the stress of a respiratory infection, which can exacerbate existing health issues. For them, RSV can quickly escalate into something more serious, landing them in the hospital. In severe cases, it can lead to respiratory failure, requiring intensive care and mechanical ventilation. Therefore, it's crucial to monitor symptoms closely and seek medical help when needed. How can you tell if you or your child has RSV? Well, it often starts like a common cold. You might experience a runny nose, congestion, cough, and maybe a low-grade fever. Babies might also show signs of irritability, decreased appetite, and difficulty breathing. If you notice your child is breathing faster than usual, their ribs are pulling in when they breathe, or their skin looks bluish, especially around the lips and fingernails, seek immediate medical attention. These could be signs of difficulty breathing, and it's crucial to get help right away. Section 4. Treating RSV. What can you do? Unfortunately, there's no specific cure for RSV. Most cases resolve on their own with time and home care. Just like with a cold, plenty of rest, fluids, and over-the-counter medications can help manage the symptoms. For severe cases, hospitalization might be necessary. In the hospital, your loved one can receive oxygen therapy, help with hydration through intravenous fluids, and other supportive care to help them recover. Section 5. Prevention power, protecting yourself and others. The good news is, there are things you can do to reduce the risk of getting and spreading RSV. By taking a few simple steps, you can protect yourself and those around you from this contagious virus. First and foremost, wash your hands frequently with soap and water for at least 20 seconds. This simple act can significantly reduce the number of germs on your hands. If soap and water aren't readily available, use an alcohol-based hand sanitizer. Make sure the sanitizer contains at least 60% alcohol to be effective. Avoid close contact with anyone who is sick, and if you are sick, stay home to prevent spreading the virus. This helps to protect those who are more vulnerable, such as the elderly and young children. Regularly cleaning and disinfecting frequently touched surfaces, like doorknobs, toys, and phones, can also help reduce the spread of germs. Use disinfectants that are effective against viruses to ensure thorough cleaning.